Main thing I'm gonna tell you, a lot of my students do this mistake is they give oxygen right away. Always remember that before you do any nursing intervention, especially any medications, even oxygen, you need to have information. You have to do assessment first. So before you can even give any oxygen, you need to make sure you have the oxygen level. What is the current oxygen saturation of the patient? Hi everyone, welcome back to my channel. If you're an internationally educated nurse or an IEN preparing for your Inspire Global Assessment, or your NCAS, CBA, and SLA, then this video is for you. Today, I'm gonna walk you through step by step on how to go over this type of nursing case scenarios to help you succeed in this type of assessment. So let's get started on our NCAS case scenario review 1. This is the information that you are given. So just focus on this information and don't add anything else. So in this nursing case scenario, you are managing a patient with shortness of breath. You're working on a medical surgical unit. Your patient, Mr. John Doe, is a 68-year-old male and experiencing shortness of breath. He was admitted with a diagnosis of heart failure and has a history of hypertension and type 2 diabetes. Now, put yourself in this scenario. Imagine yourself in the lab room or the nursing simulation room, and you're an internationally educated nurse or an IEN, and you are doing your Inspire Global Assessment or NCAS. You're given this scenario. Now, with this information in front of you, the first thing you need to do is pick out the key information that you will need to do your first assessment with your patient. So now pause this video for a minute, give yourself time to think, maybe write down in your notebook in front of you, write down your answer, and then once you have the answer, press play again and I'll discuss the answer with you. Okay, now you have your answer. Now let's discuss it step by step. So the first thing that I would pick out in this case scenario would be the patient's age. So the patient is 68-year-old. As nurses, we all know this, that the patient's age is crucial in any scenario, not just simulation, but also in real life situation, because age can influence the likelihood of developing chronic conditions. Also, the likelihood of exacerbation and acute condition. Also, patients' age that can affect the severity and management of their chronic and acute conditions. So in this particular case, I'll give you some rationales why the patient's age is important. So for Mr. John Doe, he is 68 years old. He's more likely to have chronic conditions such as heart failure, hypertension, and diabetes due to metabolic changes, because these are age-related changes in their heart, in their liver, in their metabolic function, like I said, in their lung capacity. Also with age, it increases the vascular stiffness and it reduces the heart's compliance, right? And it makes them more susceptible to heart failure under a lot of stress. Also with your patient, with older adult patients, they have reduced ability to compensate for any acute conditions or exacerbation happening in their body. So for example, in this situation, the heart failure, there's exacerbation, right? Respiratory muscles are getting weaker, right? That's why the patient is having shortness of breath. And fluid regulation mechanisms are less effective. So for example, lung capacity, that will be affected. The patient's kidney functioning, that will be affected as well. And also the liver. We'll talk about the liver more because now we're going to talk about medication sensitivity. So for older adults, there's also higher risk for adverse effects in terms of medication. So if a patient, for example, is having shortness of breath and the patient is given a medication like Lasix or furosemide, there will be changes in terms of drug metabolism and excretion. So for example, renal function may decline with age and that will increase the risk for hypokalemia, right? So electrolyte imbalances and volume depletion as well. And lastly, with older adult patients, they might not always present with the classic symptoms of heart failure. So for example, for your patient, Mr. John Doe, fatigue and generalized weakness might be prominent compared to dyspnea, which requires careful assessment and closely monitoring from the primary caregiver. So that would be you, that would be the nurse, right, taking care of this patient. The next thing I would look at in this case scenario would be the patient's admitting diagnosis, which is the heart failure, and the patient's medical history, which are hypertension and type 2 diabetes, because that's very critical for several reasons. The first reason would be knowing the diagnosis and the medical history will guide your focus assessment and your prioritization. And that is one of the main things that they are assessing during your NCAS or Inspire Global assessment. Are you able to prioritize, right, your nursing actions and also your focus assessment? Can you specifically point out what are the key assessments that you need to do in terms of your scenario? Because you will be given different kinds of scenarios. So your focus assessment, right, your physical assessment will vary depending on the patient's situation. So knowing the patient's diagnosis of heart failure and the history of hypertension would alert the nurse to prioritize cardiac functioning and respiratory functioning. So your focus assessment would be cardiac and respiratory, because hypertension is a major risk factor for heart failure because it puts a pressure and strain on the heart, and that can lead to left ventricular hypertrophy and subsequent heart failure, right? So in terms of your prioritization, those are the key information that you would need. So your nursing actions would be prioritizing that. Next, identifying potential complications. So knowing heart failure, history of hypertension, and type 2 diabetes, you'll be able to identify potential complications or exacerbations of symptoms. So type 2 diabetes increases the risk of vascular complication. Or if this is a CBA, you're doing your CBA questions and you're given this scenario, that's something that you need to think about as well. So the patient is at risk for poor wound healing, infection, and complication in terms of the vascular. Additionally, the patient has heart failure, so that can promote atherosclerosis and any microvascular disease as well. Again, put these conditions together and that will increase the patient's risk for acute events like pulmonary edema. So knowing that information in the back of your head, you should already be thinking the patient is at risk for pulmonary edema. So what are some key interventions that I can do? What kind of focus assessment I can do? So next, nursing intervention. So knowing the diagnosis, medical history, patient's age, you'll be able to tailor your nursing intervention based on that information. You'll be able to plan and implement targeted interventions. So for example, patient has heart failure, right? The patient is having shortness of breath. What does that tell you already? So if I'm the student, that information gives me is it's telling me that I need to monitor for signs of fluid overload, right? Especially in patients with heart failure. So what are the symptoms, right? What are the signs of fluid overload? So for example, peripheral edema, crackles in the lungs, right? In terms of my discharge teaching, I'm going to focus on managing the patient's symptoms, right? Teaching the patient the symptoms, managing it at home, but also teaching the patient diet restrictions, such as lowering salt intake. Another thing would be medical history of type 2 diabetes. So what does that tell you? If a patient has type 2 diabetes, again, you need to do discharge teaching in terms of monitoring their blood sugar, right? And awareness of interactions in terms of their medications with diuretics and glucose control. Okay? And speaking of medications, again, if a patient has history of hypertension and diabetes, right, you need to be more cautious with medications like furosemide or Lasix, because diuretics can lead to electrolyte imbalances, more specifically hypokalemia. With hypokalemia, every time you think of electrolyte imbalance, more specifically potassium, always think about the heart. Always think about the patient's heart. So that can exacerbate arrhythmia, right? Especially in patients with heart failure or any heart conditions, I would say. Also, the patient has hypertension. So if a patient is on antihypertensive medications, that should be titrated or adjusted more carefully to prevent hypotension. Also, the patient can manage the heart failure more effectively. So you need to coordinate with the doctor, with doctor's orders, but also maybe the pharmacist as well, and then doing discharge teaching in terms of patient's medication. So knowing all that information, During your Inspire Global assessment or your NCAS or even in real life situation, you need to acknowledge and pay attention to the patient's main diagnosis and patient's medical history, but also the patient's age, because that will help train your brain, train your mind to anticipate patient complications. Knowing that, you'll be able to prioritize your nursing interventions and your nursing actions appropriately. With Mr. Doe's medical history, it directs your attention to potential exacerbations of heart failure and diabetic complications as well, such as hypoglycemia or hyperglycemia. So this is the step one when you're doing your assessment, is the initial patient assessment. So as the primary nurse, that is you, what's the first thing that you would do? So again, pause the video, come up with your own answer, write it down in your notebook, and once you have your answer, press play and we'll discuss it together. Okay, now you have your answer. Perfect. So read your answer in front of you and then compare it with the answers I'm going to give you. So the priority action that you need to do based on this assessment, based on this patient's case. So the priority nursing actions that you need to do in this scenario is to assess the patient's airway, breathing, and circulation. So that's part of the ABCs of nursing. Next, observe for signs of respiratory distress, such as when the patient is using accessory muscles. So if you see nasal flaring, right, the patient is trying to breathe and then you see the nasal flaring, that's a sign that the patient's also using accessory muscles. Or if you see their chest expanding, right, they're having dyspnea, they're having difficulty breathing, again, that's another use of accessory muscles. If a patient has cyanosis or alteration in level of consciousness. Then next, check the oxygen saturation level and also the patient's vital signs. So in this case scenario, the patient is having shortness of breath, and that is the critical symptom that you need to pay attention to, because that could indicate that the patient's heart failure is worsening. So you have exacerbation of heart failure, but that can also mean fluid overload or another acute issue like pulmonary edema, which we discussed earlier. So ensuring the patient's airway is clear, and then you are giving the patient oxygen, right? That's the main thing. That's the first step that you need to do in this case scenario. So next would be your focus patient assessment. So when you're doing your assessment, are given extra information. So during your focus assessment, you observe that Mr. Doe is sitting upright, using accessory muscles to breathe, and the patient has bilateral crackles in the lower lung field. His oxygen saturation is 88% on room air. Again, you're the primary nurse, so what is your next nursing action? Again, pause this video, write down your answer, and once you do, press play and we'll discuss it together. Next step that you need to do is immediately administer oxygen as prescribed. Main thing I'm gonna tell you, a lot of my students do this mistake, is they give oxygen right away. Always remember that before you do any nursing intervention, especially any medications, even oxygen, you need to have information. You have to do assessment first. So before you can even give any oxygen, you need to make sure you have the oxygen level. What is the current oxygen saturation of the patient, right? So make sure you are taking your the patient's oxygen saturation level and also the patient's vital signs and any other assessment that you think is important before providing any medications or any interventions. Administer the oxygen as prescribed by the doctor. Elevate the head of the bed because that will improve the patient's lung expansion, and notify the physician. You need to notify the doctor. During simulation, sometimes the instructors, what they're waiting for is for you to call the doctor, right? They'll keep giving you information over and over, or sometimes what they'll do is they'll make the situation worse until you do the action of calling the doctor, because that's what they're waiting for. Right? So make sure you notify the doctor, because you can't do much else until you call the doctor, because you need to get a physician's order. Just to give you some pathophysiology and rationale behind this. So the patient is having crackles, right? The information we had previously, right? The patient has bilateral crackles in the lower lung fields, because what's happening is there's now fluid accumulation in the alveoli because of pulmonary congestion, and that is a hallmark symptom of heart failure. Why do we want to elevate the head of the bed? Again, I said to improve lung expansion. because it's going to reduce venous return to the heart, right? And that will decrease pulmonary congestion. Because what's happening here in left-sided heart failure, the left ventricle, what happens is the left ventricle is like getting weak, right? It's like this, right? It's not able to pump the blood effectively. So what happens when the heart is not able to pump effectively? It's like very slow, right? What's going to happen is fluid backing up, right? So the fluid will back up to the pulmonary circulation or the lungs. All the fluid that's supposed to be ejected by the heart is now backing up to the lungs. It's not perfusing properly. So now you have all this fluid and pressure in the lungs, and that's why the patient is having pulmonary congestion, or the patient is having shortness of breath, because the increased pressure pushes the fluid from the capillaries into the alveolar space, and that will reduce oxygenation, oxygen diffusion, and it'll cause dyspnea to your patient. And that's why you need to administer oxygen right away and elevate the patient's head of the bed. We're waiting for the physician, for the doctor to respond, so either calling you back or maybe you're on hold, you can still do some intervention. So what nursing intervention should you implement while you're waiting for the doctor's order? Before you give any interventions, you need to monitor vital signs close. So in this situation, you can just have the vital signs attached to the patient. You're able to monitor the patient's blood pressure, right, the patient's heart rate, but also the patient's oxygenation. So sure you are attaching that oximeter to your patient. And then next, you can assess for peripheral edema. So again, we talked about, right, fluid backing up, or heart failure exacerbations. You can measure intake and output, right, to evaluate fluid balance, because again, we have fluid imbalance in this situation. So you need to do strict in and out. And also you need to review recent lab results such as BNP. So what happens in the body is BNP gets released when the heart's ventricles are stretched out. So again, we talked about the heart, right? The heart is getting weaker. So what happens? The ventricles gets stretched out, right? Due to increased pressure, right? And when this happens, what the body releases is a biomarker for heart failure, because that means heart failure is getting severe, and that's when BNP gets released. So for healthcare providers, doctors, nurses, even pharmacists, they'll also look at this, because that tells us that the patient's heart failure is getting worse. It's not getting better. So that's why, as a nurse, you need to make sure that you are also looking at the patient's lab results. Okay, next, speaking of lab results, you also need to monitor the patient's electrolytes, which we discussed earlier on the first slide, right? So electrolytes needs to be monitored because diuretic therapy, right, can cause imbalances. So every time you give medications as well, especially Lasix, that can cause imbalances in the electrolytes. So in this situation, it can exacerbate cardiac issues, so we can kind of predict that hypokalemia might happen. So speaking of medication, the physician, now the doctor will call you back, or now the patient is on the phone again, and the doctor orders furosemide or Lasix IV, and to continue oxygen therapy. So great. So now, what are your nursing considerations when you are administering this medication? Again, pause the video, come up with your own answer, and once you do, press play again. Okay, so before giving this medication, you need to check the patient's blood pressure and potassium level. Because what happens when you give Lasix or furosemide, it's a loop diuretic. It will reduce fluid overload, and that is what we want for this patient. However, it can cause hypotension and also hypokalemia. And that's why you need to check the patient's blood pressure and potassium levels. Now, after giving this medication, you need to monitor the patient for improved respiratory status. Every time you give nursing actions or you provide nursing interventions, you always have to check after, is that effective, right? Because if it's not effective, then you need to come up with another answer, come up with another solution, right? So for this situation, you are giving the medication, then you need to monitor the patient's improved respiratory status, increased urine output, and any signs of adverse effects such as dizziness or arrhythmia. So in this situation, make sure, again, checking your vital signs, right, for your patient. Check the oxygenation level of the patient, and also just attaching that oximeter so then you can just monitor the patient's saturation level. Another thing in terms of the rational and pathophysiology, when you give the diuretic, it will reduce preload and afterload, and that will be achieved by diuresis because you're releasing all this fluid. And as the fluid releases, it reduces the workload, and that will allow the heart to pump more efficiently, and that's why the respiratory should get better. However, what can happen is you have electrolyte imbalances, you can have volume depletion. So as the nurse, as a primary nurse, just because you gave all those medication, you gave those nursing action, that doesn't mean that you stop taking care of your patient, because something can happen still. So next would be patient education. So Mr. Doe, because you gave the medication, you give the oxygenation, now the patient is getting better. The heart is pumping better, right? There's less fluid in the lungs, and now the patient's preparing for discharge. So yay. So that's what we want for this patient. Now, as the primary nurse, you need to provide patient education before the patient gets discharged. So in this situation, it would be about managing heart failure. So what are some key education points that you can provide about managing heart failure? Again, pause, and then once you have your answer, press play again. So in this situation, we want to teach the patient to monitor their weights daily and report a gain of more than 2 to 3 in the day. Because if the patient has a weight gain of more than 2 to 3 pounds in a day, that can indicate that the patient is retaining water again. So they need to call the doctor, right? Also, when they are taking their weights, you need to make sure that you tell them that it's the same day. So if they're doing it in the morning before breakfast, they need to do it in the morning before breakfast, and always keep a note of it. Next, follow a low sodium diet to minimize fluid retention. So you have to let the patient know to decrease their salt intake. Next, they have to make sure that they are taking all their medications, their diuretics, and antihypertensive as prescribed. So before you let this patient go and get discharged, you have to make sure that the patient knows when to take the medication, and also tell the patient what are some contraindications or something they have to look out for. Recognize early signs of worsening heart failure. So if a patient has increased shortness of breath, any swelling, any peripheral edema, or any fatigue, like generalized weakness, to let their doctor know as well. And lastly, schedule regular follow-ups and stay physically active as tolerated as they are able. So with heart failure, it's a chronic condition. So because it's chronic, the patient needs self-management skills. So before they get discharged in the community, they need to be able to know some information to take care of themselves, to prevent exacerbation, but also to prevent hospital readmissions, because that's what we want. We don't want the patient to go back to the hospital right away. So in this scenario, we have provided all the nursing actions, all the nursing interventions, and we went over some of the rationale. So when you are doing your Inspire Global Assessment, these are some of the things that you need to pay attention to, and this is what they are testing you for. And that's it for today's case scenario. Good job. Remember, for both CBA and SLA, you need to think critically, prioritize effectively, and think through your rationales and explain it clearly. If you found this video helpful, please let me know in the comments below and share it with another IEN who might find this beneficial. See you in the next video. Bye! If you found this video helpful, please support the channel by liking, subscribing, and hitting the bell for future videos. Drop a comment below as well to share your thoughts, ask questions, or suggest any future topics. I would love to connect with you. See you in the next video!